Hi friends, today we are going to discuss about stress among healthcare workers. I am Dr. Suresh Badadmat, Professor of Psychiatry and also Head of Telemedicine Center, NIMANS, Bangalore. Recently, a study published in February 2020 on coronavirus infection and also the healthcare personnel's stress. Majority of the healthcare personnels discussed about their healthcare concerns. First and the foremost healthcare concern were fear of being infected and infecting their family members when they go home. These were the major two concerns. Along with this, they also talked about non-availability of these protective gears like personal protective equipments, masks, stigmatization from the society, discrimination against their family members by the society, physical and mental exhaustion, loss of a patient, moral injury which causes because a patient died. The doctor and the nurses do also grieve about this. Reduce social support and isolation, which are a part of mandate during the coronavirus infection or a biological disaster, increases the stress. And above all this, managing uncooperative patient demoralizes the healthcare professional. And if you're a healthcare professional, what are the warning signs you should look for that you are going through a stress? First and the foremost is somatic complaints, or what we call it as somatic symptoms: headache, body ache, backache, generalized body fatigue, these kind of somatic symptoms. Emotionally, anxiety, panic attacks, anger, irritability, frustration. Behaviorally, becoming hostile, becoming anger, isolation, withdrawn, having alcohol, using smoking, other drugs. So these behavioral changes also can be noted. Cognitive function, or what we call it as thinking process, becoming confused, disoriented, not able to remember the things what happened yesterday, today, and difficulty in taking decision. This again adds to the what we call it as mental health stress of the healthcare workers. And further, biological symptoms like not able to sleep, decreased appetite, decreased libido, and also altered bowel and bladder habits increases the stress. Further, there was a study which has been published by JAMA Journal, and this also talked about the healthcare workers' stress in 1,257 were providing care to people infected with coronavirus. 50% of them talked about depressive symptoms, 45% talked about anxiety symptoms, 34% talked about sleep disturbance, and 72% talked about very severe distress. So this sums up the healthcare personal's stress during coronavirus infection. And also there was an interesting study which been published by Brain and Behavior and Immunity in March 2020, hardly recently, 1 month back. They did a study. This study talked about which was 234 nurses, frontline nurses who are providing care for people infected with coronavirus, and 292 non-frontline workers, that is nurses who are not providing care directly, and general public 214. When they compared the stress among the three groups, of course we will say that 234 frontline medical workers had huge stress. No, this study actually came with a what we call it as a contradictory results. It said 235 frontline medical workers did not have much stress compared to the 292 non-frontline workers and general public who also had huge stress. That means frontline workers did not have much stress, but the non-frontline and the general public had huge stress. What was the reason? The reason, when they discussed in this study, the majority of these frontline workers were volunteer. They were psychologically prepared to face the what we call it as this kind of work, and they had a knowledge of the illness. Day to day, what kind of patients they are seeing, they have been given adequate protective equipments, and they were able to deal the situation. But these non-frontline workers and the general public did not know what is happening actually in the ward where the coronavirus infected patients were taken care of. The social media is playing a huge role by giving false messages. So that adds to the stress, not only to the public, non-frontline workers, medical workers also get into severe stress. One more interesting study which I came across in the Worldmeters website, which talks about the risk of dying from the age perspective of the general population. If you look at that, the people who are in the age between 20 to 60, out of 1,000, the number of people who they are going to die is 3 to 36. That means more than 960 people are going to survive. So the anxiety, what the level of anxiety is shown is clearly depictive of social media. So that anxiety is not good for general public or also for the healthcare professional. So social media needs to be responsible in providing a good statistics. Further, there was a study or what we call it as a correspondence which has been published in the Lancet, which talked about mental health care of a medical staff in China during the COVID-19 outbreak. This study talks about how the stress of the healthcare workers have been taken care. First and the foremost, the decision makers were available and accessible, clear protocols and guidelines were laid out, training of the staff by providing adequate protective equipments, dealing with the mental health issues of the patients were dealt, isolated resting place for the staff was given, availability of protective equipments which have been clearly discussed, security personnel were there to take care of uncooperative patients, leisure activity for the staff, contacting family members, recognizing best performing doctor or a nurse per the day was also done. So this decreased the mental health stress among the healthcare workers. In 2015, there was a meta-analysis published by Cochrane Reviewer. This Cochrane study looked into the preventing occupational stress in healthcare workers. 58 studies were taken for the review, which comprised of 7,188 participants. This meta-analysis looked into 14 studies which gave CBT to healthcare personnel and found that only 13% improved. 21 studies which looked into mental and physical relaxation did not show any difference after 6 months of follow-up. 6 studies which looked into organizational intervention like shift change, change in the responsibility, how the organization works, change in modification in that also did not show any change. And this Cochrane study or the meta-analysis came up with the conclusion telling that we know very little about the healthcare personnel stress. And this is very disturbing actually, because we do not know about the stress of the healthcare providers. I think it's high time we should start investing in the stress management research on the healthcare workers. Coming to how to have the stress management in healthcare personnel. So there are 3 ways of dealing with this. First at the community level, second at the hospital level, third at the individual level. Coming to the community level, first and the foremost, the community needs to avoid stigma and discrimination against the healthcare personnel and their family members. During this disaster, they are the frontline workers. This is the least thing which we wanted. Invest in public healthcare. The budget should be improved. Following the advice of the healthcare personnel to the society at large is very essential. Making all efforts to prevent violence. Law to deal with these violent people against the healthcare personnel and destroying the hospital property should be dealt very seriously. Priority access to day-to-day general essentials should be given priority to the healthcare personnel because doctor and nurse should not be running around to get the ration, to get the electricity bill, to get the vegetables. Some kind of arrangement has to be done. Insurance to the healthcare staff is very, very essential so that the healthcare professional should not think what will happen to my family if I die because of infection. And also general public should stop using the important protective equipments like N95 mask. Unfortunately, during this coronavirus infection, everybody has N95 mask except healthcare providers. Doctors and staff nurses don't get this N95 mask, but rest everybody is wearing this mask. And above all this black marketing of these personal protective equipments is really very, very disturbing. And as they say that people make money when there is a blood on the street, this is the saddest part we can think of. Coming at the hospital level, the leader should be proactive and forward thinking. He should lead from the front, not from the back. He should say that I will also come, sure, come on, we will go together and provide care for the coronavirus infected patients. Adequate security personnel, training of the staff, availability of protective equipments is very, very essential. Protocols available in place, guidelines in place, keeping staff informed about the change in protocol or guidelines or any things which are changing very frequently has to be addressed through a virtual meeting. And also the debriefing teams, each team like a staff or the surgery team should have a debriefing, maybe virtually, avoiding the best worker for the each team every day. Accommodation and basic facilities provided in the premises, because majority of the doctors and the nurses would like to say, I'm ready to work with the patient, but if I get infected, what will happen? So please provide me accommodation within the hospital campus or away from the home, so that till this infection is averted, I will work, concentrate on the patient, I will just forget about the family. So they are also concerned if I go home and I infect the family members. This concern is real concern, and these needs to be addressed. Coming to the individual level, of course, I have to take care of myself as a healthcare provider. I should know what are the signs and symptoms. I should monitor myself, have food adequately, hydration, sleep, rest, have to maintain routine, scheduling, training myself so that I know what is happening, how to take care of my patients. Updating the knowledge about the current situation is very essential. Contact the family members on daily basis, send them the videos and I'm doing well and how the things are evolving. That is very essential. Be aware of the protocol, guidelines. Debriefing meeting has to be done among the teams. Accepting the loss of a patient. This is one of the important point, because many of the doctors or the healthcare professionals feel that if I lose a patient, it is equivalent to I'm losing a game. That should not be there. We are a healthcare provider. So we should know that there is a chance that the patient may die. So we should learn to accept the loss. Leisure, relaxation, yoga do decrease the stress, and meditation and spiritual well-being do play an essential role in decreasing the stress. To conclude, my friends, the society has a major role to play to decreasing the stress of the healthcare professional. At the same time, hospital also need to play a crucial role by providing adequate personal protective equipments and also place to stay who are ready to work for the persons infected with coronavirus. And at the individual level, yes, everyone is responsible for their own health. Thank you very much.